We've got some breaking news this morning. The virus that causes polio has been found in New York City's wastewater. Weeks after a case of polio was found in Rockland County, health officials said the presence of the polio virus suggests wider spread of the virus among the unvaccinated.
This comes just after the CDC loosened its COVID-19 guidelines on Thursday. The new guidance lifts the requirement to quarantine if exposed to the virus, de-emphasizes screening people with no symptoms, and updates COVID-19 protocols in schools. Emily, do you know how common it is to be vaccinated for polio? Like, were we vaccinated as kids for polio? Are kids today vaccinated?
I don't know.
For polio?
Are your kids vaccinated for polio?
I don't know. I mean, they get the battery of vaccines that the doctor gives to them. But I don't remember polio being in there. I don't know. Maybe the producers know how common it is, because polio, is an awfully scary thing. That one of those things that we thought was in the past, though you see, you still continue to meet people today who lived with it. Mitch McConnell famously had polio as a child, and still suffers some of the ramifications of that to this day. So I don't know. I mean, I guess we thought we had it beaten, and then one thing it does show is the strength and the cleverness of these viruses, that their ability to hang around until they can get another beachhead.
Yeah, and the good people in our ear just let us know that the answer to your question. It's 93% of Americans are vaccinated for polio. Okay. And the theme of today's episode, unintentionally, has been, I think, the decline of institutional trust. And it's amazing. I actually don't think we've really understood or grappled with how far-ranging the consequences are going to be of what happened with COVID and with vaccines, and with the sort of shifting talking points from the medical establishment and the political establishment about what they actually did, what their value actually is, versus what they were saying initially, whether it was with face masks, whether it was, they may seem like small things to people in the medical establishment, but they're actually really big to people who are looking for life-saving information, who are not professional doctors or professional politicians, and rely on them to tell us all. I mean, we're not doctors by any stretch of the imagination. Right. We didn't even know what the polio vaccination rate was, but you have to rely on the professionals to trust them. And so I think this is an early symptom in a long sort of period post-COVID. This is an early but serious symptom of the decline in trust, because I think a lot of people, in the way the vaccine was talked about originally, the COVID vaccine, really thought that it was something very similar to the polio vaccine, and were led to believe that it was something similar to the polio vaccine. And when you stand back and you look around and you're like, well, if I was told with such confidence and certainty one thing about this vaccine, I'm going to do a whole lot more research on this other one, because I'm going to wait and do a whole lot more research on the other one, because the people I was trusting to tell me, you failed me on this one count, and my children's lives mean a whole lot to me, and I need to think about this.
Right. Yeah. And I think from the beginning, people, the public health authorities should have been a little bit more modest and circumspect when they talked about the vaccine. And I know we had a bunch of arguments here with Kim back during Delta, where she would say it doesn't stop the spread, and a lot of people would say no, it does stop the spread, but no, it didn't stop the spread, but it did slow the spread. And so there was no willingness on the part of kind of the vaccines advocates to acknowledge some of the criticism. So you could say, you're right, it doesn't stop it, but it does slow it, and it slows it because you're 10 times less likely to get Delta. Now, in the case of the current vaccine against this new Omicron BA.5, whatever it is, might not even be slowing it. And it's important for, I think, people to be able to make those concessions to people, because our understanding of this is evolving. And if you just dig in and don't look at new data coming in, don't look at new evidence, don't acknowledge good faith, legitimate criticisms, but then counter with what benefits you still see for it, then you're going to end up losing credibility, rather than saying, look, no, this isn't the polio vaccine, which is going to eradicate or mostly eradicate polio, But here are the benefits for it. Here are the risks for it. You make your decision, and we didn't do it that way.
No, and we're just emerging from a news cycle in which there's a story that should have been front and center, not because of dunking on anyone or doing the I told you so thing, but because it's actually how you correct our institutions that handled this poorly. And that would be Anthony Fauci and Joe Biden, vaccinated multiple times, boosted, getting COVID, and juxtaposing it with the clips. This was only a story in conservative media of Joe Biden repeatedly calling this pandemic of the unvaccinated, saying if you get your vaccine, you're not going to spread it, you're not going to get it, et cetera, et cetera. All of these quotes that at the time they actually should have known better from saying with such confidence and such authority. And if you juxtapose that with what happened, it's really like the big story there is that people were paying attention. The American people were paying attention to that. And they didn't take COVID lightly until they started, a chunk of the American public was like, well, what is actually going on? What's actually happening with this? Because so many things that were said with such confidence and arrogance turned out not to be true or turned out to be misleading at best. And that's a huge story because people do pay attention. They know exactly what Joe Biden was saying on the campaign trail. They know exactly what Dr. Fauci was saying in the early days of the pandemic and the early days of that vaccine, and they know exactly what happened, and that is a trust crisis. And the media is paying so little attention to it because they're terrified of getting on the wrong side of censors, of getting on the wrong side of the government that can, activate or can make complaints about what should be allowed on TV, what should be allowed to question, what you should be allowed to say, and being called an anti-vaxxer because that was such a fervor, and it's such a bad way to get labeled. You get labeled as that. You can't, talk about anything, even if you're raising legitimate questions and you're pro-vaccine. It literally doesn't matter. So you get this blackout in the media, but it's not a blackout with the public. The public understands what happened, and if the media shines no light on it, these institutions basically have no incentive to fix what went wrong.
And I hope that people who are following this will understand that the polio vaccine has been, thoroughly tested, and is actually, a safe and effective vaccine. And so I think for a lot of people, the phrases safe and effective have become kind of punchlines, for a lot of viewers of this show for sure. But this one actually is. And if you're, if you have a young kid who hasn't been vaccinated yet, or you're not sure, you should look into it. Call your pediatrician. Like, this is something you absolutely want to do. You do not want your kid, you yourself do not want to get polio.
Yeah. Well, and it's not just, by the way, it's not just Democrats who were misleading the public about the vaccine. It's not just pharma that was misleading the public about the vaccine. It was basically the entire political establishment, left and right. And Republicans, I think, were probably better than Democrats about asking some serious questions about COVID. Rand Paul is one really good example. Thomas Massey, they were better asking responsible questions, but they got treated as anti-vax idiots by the media, which meant pretty much nobody on the left wanted to touch it. And so it just turned into a right-wing conspiracy theory when, in fact, there were very legitimate questions to be asked, and we are now reaping the consequences, and we will continue to reap the consequences of this just complete lapse of judgment, lapse of competence in both the media, the medical establishment, and the political establishment on this question. And the consequences aren't just going to be QAnon. The consequences are going to be, people's health and people's lives, and it's just a big failure all around.
But right, and by all around, I want to make sure I'm clear, though, that I don't think that the vaccine skeptic side here has clean hands either, because just as the kind of pro-vaccine side was being kind of black and white about what the data was showing, the vaccine skeptic side, or leaning into the anti-vaccine side, was also refusing to acknowledge the genuine benefits, the upsides of the vaccine, particularly against Alpha and particularly against Delta and against Omicron when it came to, the elderly. That's not the case for all people, but who were vaccine skeptics. But certainly a lot of them would, if you only listen to them, you would think that there was absolutely no upside to it, that there was no benefit to it, which also was not true.
And I feel like that's what happens when you're attacked as an anti-vaxxer and you're attacked for asking questions. People dig deeper into their trenches. And so it's just a totally lack of productive, it just becomes a complete misuse of our resources. It becomes a completely unconstructive exercise when the media is so sensitive about so sensitive about like the allowing for these boundaries of acceptable conversation and not being skeptics, which journalists are supposed to be skeptical of our establishment. And when you just sort of start taking or holding the line, you end up really pushing people further and further into their trenches, and it's not helpful for anybody. The information gets worse, and the politics get worse.
Right, because there is actual information that people need, and the polio situation is a perfect example of it.
Yeah.
Like that.
Well,
Get it.
And yeah, no, absolutely, it is a really perfect example. We'll be back with more Rising right after this.